Mr. Speaker, I beg to move that aware that Article 43(1) of the Constitution of Kenya provides that every person has the right to the highest attainable standard of health, including reproductive health care, noting that in Kenya we have 5 national teaching and referral hospitals, with Kenyatta University Research and Teaching Hospital in Kiambu County and Moi Teaching and Referral Hospital in Eldoret, Uasin Gishu County, being the only ones outside Nairobi, concerned that the bed capacity, medical equipment, and human capital in these national teaching and referral hospitals are not sufficient to absorb all patients seeking specialized treatment. Further concerned that many Kenyans with critical health conditions travel long distances in order to access specialized services in Moi Teaching and Referral Hospital in Eldoret or Nairobi, where the other 4 national teaching and referral hospitals are located, leading to high cost of travel, augmented disease, and some cases, deaths along the way. Now, therefore, the Senate urges the Ministry of Health to 1. Establish national teaching and referral hospitals in Coast, Eastern, Northeastern, Nyanza, and Western regions, and 2. Fully equip the national teaching and referral hospitals with modern equipment, medical supplies, and personnel, and 2. The county governments to allocate more funds to the respective health dockets to adequately facilitate their county level 5 and 6 hospitals in order to enhance provision of critical health services, to reduce the demand for such services from the national teaching and referral hospitals. Mr. Speaker, this is almost a very straightforward motion, which recognizes the fact that there are areas with teaching and referral hospitals that are Nairobi, Kiambu, and Rift Valley, and that the rest of the regions, which are the former provinces in Kenya under the previous constitution, do not have these very important facilities which deal with specialized treatment of our people. The current referral hospitals, and I would look at the profile of each. The first one is Kenyatta National Hospital, which is in Nairobi, Upper Hill. It has 1,800 beds. It is actually the largest in East and Central Africa, and it serves as a teaching and referral hospital for University of Nairobi. The other one, which is Moi Teaching and Referral Hospital, MTRH, is located in Uasin Gishu in Rift Valley. It has a capacity of 1,020 beds, and it serves as teaching and referral hospital for Moi University. The third one is Madari, which is in Nairobi. It has a capacity of 800 beds, and it specializes in mental health services. The other one is the Kenyatta University Teaching and Referral Hospital, which is located in Kiambu, which has a capacity of 600 beds. And the fifth one is the National Spinal Injury Hospital, which is also located in Nairobi, and it deals with treatment and rehabilitation of spinal injuries. These hospitals, Mr. Speaker, are crucial as they provide specialized services and are equipped to handle complex medical services. They are operated and financed through the exchequer from the national government, Mr. Speaker. And I would like to say this, that there are adequate provisions in the Constitution, in national development frameworks, and other statutes, Mr. Speaker, that deal with the provision of health care. The first one, Mr. Speaker, is a right under the Constitution, right to access of quality health care as is provisioned under Article 43(1)(a) that states every person has the right to highest attainable standard of health, which includes access to health care services and reproductive health. Mr. Speaker, this motion urges the state to do its obligations. And the first obligation, Mr. Speaker, under this provision of the Constitution is to make necessary policy framework and other measures to achieve progressive realization, to achieve attainment of this right. Mr. Speaker, generally, primary health care is devolved, and we have tried to achieve equitable distribution of this health care, because under devolution, there is money that goes to counties as shareable revenue, which then deals with level 1 up to level 6 hospitals, but the distribution of these national teaching and referral hospitals have not achieved, being just in 3 counties, that is our regions, that is Nairobi region, Central region, and Rift Valley region. We've not achieved that equitable distribution of the hospitals, and therefore access to quality, highest attainable quality health care has not been achieved. The other framework that has requested or has required our government to ensure that there is provision of this health care is the Sustainable Development Goal. Mr. Speaker, under SDG 3 or Sustainable Development Goal 3, which talks about good health and well-being, this goal ensures that we have healthy lives and that we promote well-being at all ages of our people. And the key target under the Sustainable Development Goal 3 is that we need to achieve or attain universal health coverage. I know the government or the national government, and also in collaboration with the county government, they have done quite some step, especially in the passing of legislation to do with the social health or establishment of social health authority and the establishment of social health insurance fund, that is SHA and SHIF. But then again, Mr. Speaker, this is not adequate. In terms of development blueprints for our national government, we have the Kenya Vision 2030, and in that blueprint, Mr. Speaker, it prioritizes the provision of equitable, affordable, and quality health care as a pillar for socio-economic transformation, Mr. Speaker. Now, the word that captures me under Vision 2030 is the term equitable, that even as we are struggling to prioritize healthcare, that provision of healthcare must be equitable. So, under the national government hospitals, which provide specialized treatment, they are not equitably distributed, Mr. Speaker, because then they only exist in 3 regions. So, this motion, which requires, which urges, which implores the national government to establish these national referral hospitals, is not just requesting for those referral hospitals to be established, but to be established equitably within the regions. Mr. Speaker, there is also the National Health Policy 2014 to 2030. This is a national framework designed to align the SDG goals with specific focus on implementing the constitutional provisions for health. So there is also the National Health Policy 2014-2030 that then seeks to establish a framework on which to operationalize the provisions or to actualize the provisions of the Constitution, that is provision of health care to all citizens, which is affordable and which is quality in nature, Mr. Speaker. This quest to establish these hospitals in these regions, Mr. Speaker, is also to ensure that we have equitable distribution of national resources. Mr. Speaker, under the Constitution, under the devolved ecosystem, we have tried under the laws that we pass in this House, that is the Division of Revenue Act, the County Allocation of Revenue Act, and the County Government Additional Allocations Act, to distribute equitably the resources in the county governments. But there is lack of a framework to make sure that every region in Kenya gets equitable distribution of the resources under the national government. Mr. Speaker, I've always wondered that after we distribute the money as shareable revenue to counties and conditional grants, we don't have any framework to make sure that whatever remains in the national government has been distributed equitably. Actually, what goes to region or different regions in the country mostly has to do with political expediency. Possibly how many votes a county or a region brings on the table, so much so that if you come from a region that does not have a lot of votes, then you'll be left behind in terms of development from the national government. And so the quest for equitable distribution of resources, or the national government resources, this framework to give or to bring hospitals, to establish hospitals within the regions is part of that quest to have equitable distribution of resources. And policies cannot be passed under the Senate, they are passed under the National Assembly. There should be a framework of making sure that if we pass a national government budget, then some money should go to counties, say even 1 billion or 2 billion per county, to make sure that the national government money or resources are equitably distributed within the regions. And if that was happening, Mr. Speaker, then such a motion would not even be necessary. But it is necessary because there is no framework for making sure that the taxpayers' money go equitably to the different regions of our country. So this motion is fashioned or is established or is geared towards ensuring that the health services can be distributed equitably. Otherwise, then achievement of equitable and highest attainable healthcare within the regions would still remain a mirage, Mr. Speaker. So my proposal really is that we establish in the former regions, the coast region, that is the former provinces in Kenya, national referral hospitals, and these regions are coast region. It does not have a referral hospital. We have the northeastern region, that is the northern frontier districts, where, Mr. Speaker, you come from. We don't have a referral hospital. The former. The eastern province, former eastern province, there is no referral hospital. There's the Nyanza region, although today I'm told that information could not be accurate because we have Jaramogi, which might have transitioned to national teaching and referral, and possibly Kisii is almost there. But if they have not been established there, then that is the thrust of this motion, that let us have also in the western region a national teaching and referral hospital. In the former Nyanza region, we also have a teaching and referral hospital. We already have one in Rift Valley, in Nairobi, and in Central. And apart from just distributing these resources equitably, we'll also reduce the distances that patients have to travel and making it cheaper to access the specialized health care. I'm imagining somebody who comes from Lamu, Tana River, they have to travel all the way to Nairobi to access specialized treatment in the Kenyatta Hospital, Teaching and Referral Hospital, or the Kenyatta University Hospital, Teaching and Referral Hospital, or they go to Eldoret in Uasin Gishu at the Boy Teaching and Referral. It's very expensive. And when you have specialized operations, for example, brain operation, you must also go for clinics. It doesn't end there. So you can imagine maybe every 2 weeks you're supposed to travel from Lamu and go to access the clinics. Then it becomes extremely expensive, and therefore to reduce these expenses, we are proposing that in the coastal region, for example, the people from the coastal region can decide, is it Taita Taveta that we're establishing that hospital? Is it in Mombasa, a new hospital, or upgrading the Coast General Hospital? Shall it be located in Kilifi or Tana River? So that we have the people of that region getting these very important services, Mr. Speaker. I would want to say that there are also other benefits that come with having a referral hospital in a region. For example, if people go to Eldoret, for example, they are treated, but the people who have taken them to the hospital, they can't spend at the hospitals. And so they spend around in the Eldoret town, and they bring a lot of money to that town in what we call medical tourism, Madam Speaker. If you had these hospitals also in the coast region, the western region, the lower eastern region, or the eastern region, then also such benefits would accruing from the existence of these referral hospitals will also be enjoyed by those regions, Mr. Speaker. So we are crying that we want equitable distribution of these healthcare facilities to reduce the traveling expenses of these people. And at times, it's not just about the expenses. These people end up dying along the way. If you come from Lamu and you have to travel all the way to Nairobi, those are about 1,000 kilometers. Before you reach Nairobi, the patient could have passed away. And Mr. Speaker, this motion that can be improved upon, because if you look at the lower northeast, the former northeastern region, shall we put it at the headquarters? Because at times, the former regional headquarters of that region could be very far off from the counties. So it's also possible not just to use the previous headquarters of the provinces. We can choose a place where it is central so that you can locate that referral hospital, Mr. Speaker. So it is subject to a lot of debate, but the most important thing is let us have these hospitals established in these regions so that we can have this healthcare thriving, and we are able to assist our people to achieve at highest attainable medical care. And with this, Mr. Speaker, I beg to move and request Senator Beatrice Ogola to second this very important motion. I beg to move.
Beatrice Ogola, you may second.
Thank you, Honorable Speaker, for granting me the opportunity to second the motion of Senator Mwashume